Today, I want to address something many of us may have been reluctant to face. Recognizing the subtle signs that a loved one in their later years might be entering the final phase of life. Have you noticed that someone you love, perhaps a parent, grandparent, or close friend, has shown subtle but concerning changes over the past year? Many assume that death in old age happens suddenly. However, the truth is that our bodies often send us quiet warnings, sometimes months, sometimes even a year, before life reaches its final stage. The problem is that most of us miss these signs because they seem small at first. It's only later, when we look back, that we realize those subtle clues were there all along. By then, it might feel too late to prepare, too late to make those last memories count. In today's video, we're going to talk about 5 key signs that often appear in the final year of life. These signs are not guesses or mere myths. They are based on real patterns that researchers and doctors have observed in individuals who have lived long, meaningful lives. By the end of this video, you'll know exactly what to look for in your loved one's body and lifestyle, and most importantly, what you can do to provide comfort, care, and dignity in their final stage. Recognizing these signs early gives you the chance to emotionally and practically prepare for what lies ahead. With this knowledge, you can help ensure that your loved one's last months or weeks are filled with compassion, peace, and meaningful moments. So, if you're ready to learn about these 5 important signs and discover how you can be better prepared for the future, please stay with me until the end. Together, we will discuss what these signals mean, share some personal stories and examples, and explore practical tips for care and comfort. Let's get started. One of the earliest, most telling signs that a person may be entering the final phase of life is unintentional weight loss. At first, this weight loss might appear subtle: a belt that needs tightening, clothes that hang looser, or a once hearty appetite that seems to fade away. Many families dismiss these changes as simply part of getting older. However, when weight loss occurs without any deliberate effort, it is rarely a positive sign. When an elderly loved one loses weight without trying, it often indicates that their body is no longer absorbing nutrients as effectively as it once did. As our bodies age, the efficiency of the digestive system decreases, and our muscles naturally begin to atrophy. However, if you notice that weight loss happens rapidly, or that it is accompanied by a decrease in appetite, it may be a sign that the body is struggling to process essential nutrients. This can lead to muscle wasting, which not only weakens the body but also increases the risk of falls, fractures, and other injuries. For example, consider a scenario in which a family notices that their 82-year-old mother has started to lose weight over several months. Her once fitted clothes now hang loosely on her frame, and mealtimes have become a struggle because she no longer seems interested in eating. In some cases, this weight loss is linked to chronic conditions such as cancer, heart failure, or kidney disease. Even conditions like depression or cognitive decline can reduce one's appetite, creating a downward spiral where the body isn't receiving the fuel it needs to function properly. Some families try to remedy the situation by encouraging their loved ones to eat more or by offering their favorite foods. However, if the weight loss continues despite these efforts, it is important to recognize that the issue is not simply one of diet. It's the body signaling a deeper decline. In these cases, the focus should shift from forcing large meals to ensuring comfort and quality of life. Offering easy-to-eat, nutrient-dense foods and staying on top of hydration can make a significant difference in maintaining a decent quality of life. If you've noticed significant, unintentional weight loss in an elderly loved one, especially if it is paired with a fading appetite and a noticeable decrease in strength, it is time to pay close attention. This sign is not about physical appearance alone. It is the body sending a clear message. Understanding this message allows you to take proactive steps and prepare for the road ahead with clarity, compassion, and practical care. Another key warning sign is extreme, persistent fatigue that does not improve with rest. This is not merely feeling tired after a long day. It is a profound exhaustion that makes even the simplest tasks seem overwhelmingly difficult. You might Observe that a loved one who was once active and engaged is now struggling to rise from bed, complete daily routines, or even maintain a conversation without becoming breathless. Imagine watching someone who once eagerly participated in family gatherings and social events gradually become too exhausted to join in. Simple activities such as making breakfast, getting dressed, or walking across a room can become monumental challenges. This type of fatigue is more than just a natural part of aging. It is a sign that the body is beginning to conserve its remaining energy. As organs slow down and the efficiency of bodily functions declines, the body starts redirecting energy away from everyday activities to support the most essential functions. This phenomenon often occurs because, as the body prepares for its final phase, it shifts its focus from sustaining high energy output to preserving vital functions. The heart may not pump as efficiently, circulation might become sluggish, and the muscles may not receive sufficient oxygen. As a result, even routine tasks can feel insurmountable. This energy crisis is not only physically debilitating, but also emotionally distressing. Many seniors who once prided themselves on their independence may begin to feel frustrated, embarrassed, or isolated because they are no longer able to do what they once could. For families, witnessing a loved one struggle with extreme fatigue can be heart-wrenching. It is important not to mistake this fatigue for laziness or a lack of willpower. Instead, see it as a clear signal that the body is conserving energy in preparation for a deeper decline. The best approach is to allow the person to rest, create opportunities for them to conserve energy, and focus on making their daily life as comfortable and stress-free as possible. Practical tips include scheduling short, frequent periods of rest throughout the day, creating a calm and quiet environment, and engaging in gentle activities that do not overly tax the body. The aim is to cherish each moment, maintain quality interactions, and focus on comfort rather than on pushing for high levels of activity. When extreme fatigue becomes apparent, it is a sign that every moment should be filled with kindness and understanding, ensuring that the person feels valued and supported during this challenging transition. If you're finding these insights valuable, please comment 2 below to let me know you're with me on this journey. A further sign that an elderly person may be nearing the final stage of life is a noticeable decline in cognitive function. You might observe that someone who was once sharp, engaging, and conversational begins to show signs of forgetfulness, confusion, or disorientation in environments they once navigated easily. It might start with occasional lapses in memory, but over time these changes can become more pronounced and concerning. For instance, consider a person who has never had any issues with memory suddenly starting to forget important dates, repeat stories, or even lose track of familiar routines. They might struggle to follow conversations, become disoriented in well-known places, or have trouble recognizing people they once knew well. This isn't simply ordinary forgetfulness, it's a deeper change in cognitive function. The brain, like every other organ, requires a steady supply of oxygen and nutrients to function at its best. When the body's circulation declines and energy is redirected, cognitive function can begin to falter. Alongside cognitive decline, emotional withdrawal is also common. A loved one may gradually reduce their social interactions, speaking less, and appearing increasingly withdrawn or indifferent. This withdrawal can be misinterpreted as a lack of interest or even depression, but in many cases, it is the brain's way of coping with its own gradual decline. When cognitive energy is depleted, engaging in conversations or social activities can become overwhelming. It is not a deliberate choice to disconnect. It is a natural part of the process of slowing down. This stage can be incredibly painful for family members who may feel as if they are losing their loved one even before the final farewell. The key is not to force engagement or try to fix the confusion, but to provide gentle reassurance, a calm environment, and opportunities for quiet, meaningful interactions. Sometimes, simply sitting together in silence or sharing a soft, reassuring word can help bridge the gap between cognitive decline and emotional connection. Remember, these changes in memory and emotional engagement are not a reflection of the person's feelings toward you, They are signs of the body's natural progression toward its final phase. By accepting these changes and adapting your approach to care, you can help your loved one feel supported and understood during this challenging time. A weakened immune system is another significant indicator that the body is beginning to wind down. As we age, our bodies are less capable of warding off infections, and what used to be minor illnesses can become more frequent and severe. You might notice that your loved one, who once rarely fell ill, now seems to catch every cold, flu, or minor infection that circulates in the community. Even small wounds, such as a minor cut or a small bruise, may take noticeably longer to heal, or they might keep reopening. This is because the body's natural healing process slows down as circulation weakens and the efficiency of the immune system declines. Chronic conditions like pneumonia, urinary tract infections, skin infections, and even oral infections become more common, and when they occur repeatedly, they serve as a clear sign that the body is losing its ability to repair itself as it once did. For example, consider a family that notices their 80-year-old father has started to suffer from recurrent respiratory infections. What was once a minor bout of a cold now results in prolonged periods of fatigue, coughing, and difficulty breathing. Even with antibiotic treatments, his recovery is slower, and he remains more vulnerable to complications. In some cases, the usual symptoms of an infection, such as a high fever, may be muted in older adults. Instead, the first noticeable sign might be a sudden drop in energy or a decline in mental alertness. It can be tempting to push for aggressive treatments, but as the body nears its final phase, the focus often shifts from curing every ailment to providing comfort. Simple measures, such as keeping the skin clean and moisturized, ensuring proper hydration, and reducing stress on the body, can be far more beneficial in maintaining quality of life than repeatedly chasing after every minor infection. If you observe that infections are becoming more frequent, or that even small cuts and bruises are not healing as quickly as they once did, it is crucial to understand that these changes indicate a weakened immune response. This is a sign that the body's defenses are failing, and it may be time to adjust care strategies to prioritize comfort, supportive care, and dignity. The final key sign is a noticeable change in breathing patterns and circulation. As the body begins its final transition, you might observe that your loved one's breathing becomes slower, more irregular, or even labored. There may be periods where they pause between breaths or exhibit a pattern known as Cheney-Stokes respiration, characterized by alternating phases of deep, rapid breathing and long pauses. Alongside these breathing changes, signs of poor circulation may become evident. For instance, you might notice that their hands, feet, or even their face appear pale or take on a bluish tint. Extremities may feel cold to the touch as the body redirects blood flow from the periphery to vital organs. These changes are the body's way of conserving energy and prioritizing essential functions, but they also signal that the heart and lungs are working less efficiently than before. In some cases, even simple activities, like sitting up, speaking, or shifting position, can cause your loved one to become noticeably short of breath. They may begin to breathe through their mouth instead of their nose, or require frequent pauses to catch their breath. In more advanced cases, fluid buildup in the lungs may occur, leading to a persistent cough, gurgling sounds, or a feeling of tightness in the chest. While these symptoms can be alarming, they often represent the body's natural progression toward its final phase. When you observe these changes, the best approach is to focus on comfort. This might include adjusting the room's temperature, using a humidifier to ease breathing, or offering small sips of water frequently. Oxygen therapy or specific medications might provide temporary relief, but the goal should be to create a peaceful, dignified environment, rather than pursuing aggressive medical interventions. Recognizing these 5 key signs: significant weight loss, extreme fatigue and weakness, cognitive confusion or withdrawal, frequent infections with slow healing, and major changes in breathing or circulation, is not about instilling fear. Instead, it is about empowering you to act with clarity, compassion, and preparedness. When you notice these signs, you have the opportunity to take important steps. Provide better care. Understanding that these changes are natural and not necessarily reversible allows you to shift your focus from aggressive treatments to enhancing comfort and quality of life. Adjust meal plans to include easy-to-eat, nutrient-dense foods. Prioritize hydration and create a calm environment where your loved one feels secure. Cherish meaningful moments. The final stage of life is not solely about decline. It can also be a time of profound connection and love. Use these moments to share stories, revisit cherished memories, and ensure that every interaction is filled with warmth and dignity. Make informed decisions. Early recognition of these signs gives you the time to discuss care options with medical professionals. Whether it's arranging for palliative care, modifying living arrangements, or making legal and financial decisions, being aware of these signals helps you plan ahead and make choices that respect your loved one's wishes. Emotional preparation. It is incredibly difficult to watch someone you care about go through these changes. Recognizing these signs early helps you emotionally prepare for the inevitable. While the process is painful, understanding what is happening can also help you find the strength to support your loved one with empathy and compassion. Every day, our bodies send us these subtle messages, little clues that, when pieced together, paint a picture of the gradual decline that often precedes the final phase of life. It is essential not to ignore these signals, but rather to embrace them as opportunities to offer comfort, love, and meaningful care. To put these signs into context, let me share a few more real-life examples. I once worked with a family whose 85-year-old patriarch, whom we'll call Harold, began to lose weight without explanation. At first, they attributed it to the natural loss of appetite that can come with age. However, over several months, Harold's clothes became noticeably baggier, and he mentioned feeling light and weak. When the family finally consulted with a healthcare provider, they learned that Harold's weight loss was a sign of his body's decreasing ability to absorb nutrients, a sign that often precedes a more significant decline. Recognizing this, the family focused on making Harold's remaining days comfortable by providing nutrient-rich, easily digestible meals, ensuring he was well hydrated, and spending extra time in quiet conversation with him. The focus shifted from trying to fix the problem to cherishing every moment together. In another case, a woman named Eleanor, in her early 80s, began to exhibit signs of cognitive confusion. Eleanor had always been sharp and sociable, but over the course of a year, she began to forget small details, repeat herself, and sometimes even appeared lost during familiar activities. Her family found it heartbreaking to see her withdraw from social events and even stop participating in her favorite hobbies. Instead of forcing her to participate in activities that were too mentally taxing, they adapted by creating a calm, familiar environment at home. They set up regular routines, played her favorite music, and maintained gentle, reassuring communication. Though it was difficult, the family learned that providing comfort and reducing mental stress were far more beneficial than trying to force cognitive engagement. Then there's the story of George, a 79-year-old man who began to experience significant changes in his breathing and circulation. His family noticed that his hands and feet would often turn cold, and his breathing became shallow and irregular. Simple tasks, like moving from a chair to the couch, left him breathless. Understanding that these signs were not something that could be reversed with aggressive treatment, his family instead focused on ensuring that George was comfortable, adjusting the room's temperature, using supportive pillows, and even arranging for a gentle oxygen flow when necessary. They found solace in knowing that they could at least make his final months peaceful and dignified. These stories remind us that the signs we are discussing are not meant to be viewed as failures of the body. Instead, they are the natural progression of life, a final phase that, with proper care, can be filled with comfort, love, and meaning. For those who are witnessing these changes in a loved one, here are some practical tips to help you navigate this challenging time. Communication. Talk openly with healthcare professionals about the signs you are noticing. Early discussions can help guide treatment decisions that prioritize comfort over invasive measures. Adapt the environment. Ensure that the living space is safe and comfortable. This might mean installing grab bars in the bathroom, using non-slip mats, and arranging furniture to allow for easy movement. Nutrition. Focus on providing meals that are easy to eat and nutrient-rich. Soft, high-calorie foods that are easy to digest can help maintain energy levels, while ensuring adequate hydration is critical. Emotional support. Encourage gentle conversations and share memories. Sometimes, even when words fail, the presence of a loved one can provide immense comfort. Respite care. Don't hesitate to seek help from palliative care professionals or hospice services. These experts can guide you in making decisions that focus on the comfort and dignity of your loved one. Self-care. Taking care of someone nearing the end of life can be emotionally exhausting. Make sure you also take time for yourself. Seek support from friends, family, or counseling services if needed. Documentation and planning. If possible, discuss the loved one's wishes regarding end-of-life care. Having these conversations early can prevent confusion and ensure that their final stage is handled with respect and compassion. Facing the signs that a loved one may be nearing the end of life is undoubtedly one of the most challenging experiences anyone can endure. It is natural to feel overwhelmed, heartbroken, or even guilty when you see these changes. But remember, acknowledging these signs is not about giving up hope. It's about embracing reality so that every remaining moment can be cherished and made meaningful. Emotional preparation is as important as practical care. Allow yourself and your loved ones to express feelings openly. Share stories of the past, laugh together, and create new memories, even if they are simple. When words become fewer and moments of clarity are brief, the emotional bonds you share can provide solace and strength. Prepare yourself to honor the person's life by celebrating every bit of joy they bring, even on the hard days. Let them know that every moment with them is treasured. Sometimes, the best way to provide comfort is simply to be present, to hold their hand, and to assure them that they are loved unconditionally. In summary, today we explored 5 key signs that may appear in the final year of life: significant weight loss, extreme fatigue and weakness, cognitive confusion or emotional withdrawal, frequent infections with slow healing, and major changes in breathing or circulation. Each of these signs offers a window into how the body is gradually transitioning and, while difficult to accept, can help you prepare to provide the care and compassion your loved one deserves. Recognizing these signs early does not mean resigning to fate. It means taking action to ensure that every remaining moment is filled with dignity, comfort, and love. When you notice these subtle changes, listen carefully. They are the body's way of communicating its needs. Use this knowledge to adjust care strategies, to cherish each day, and to create an environment where your loved one feels safe, valued, and at peace. Before I finish, I want to invite you to reflect on your own experiences. Have you noticed any of these signs in someone you care about? How have you handled these changes? Please share your thoughts and stories in the comments below. Your experiences might offer comfort or insights to someone else facing a similar journey. If you found this video and these insights helpful, please hit the like button, subscribe to our channel, and turn on the notification bell. Your support helps us continue creating content that informs, inspires, and prepares us all for life's most delicate moments. Thank you for spending this time with me today. Remember, while the signs we discussed are difficult to face, they also open the door to making the final stage of life as peaceful and meaningful as possible. Cherish every moment, be present, and take comfort in knowing that love and care can make all the difference. Until next time, my friends, stay compassionate, remain connected, and hold close those precious moments. Your love and attention can turn challenging times into memories of comfort, dignity, and enduring respect. You've got this, and together we can navigate even the toughest transitions with grace and empathy. Now, go ahead and embrace these insights with understanding, practical care, and a loving heart. You can ensure that every day is filled with connection, comfort, and the respect your loved ones deserve. Thank you for joining me today, and may you find strength and peace in every moment. Remember, by taking the time to recognize these signs and preparing for what lies ahead, you are not only helping your loved one, but also honoring the beauty of a life well lived. Every small act of care adds up to a legacy of love and compassion. Cherish every day, support one another, and let love be the guiding light through even the darkest times.